This morning we are working for you today with a special focus on mental health awareness. Our special coverage continues now with Karin Price. She's a social worker with the Sunbridge counseling program. And Karin, thank you very much for being here this morning. And first of all, tell us a little bit about Sunbridge and what you do.
All right, Sunbridge is a program under the umbrella of the Mental Health Association Oklahoma, and we provide free referral, we provide free education, and then on occasions for individuals who may not have insurance or are under-resourced, we provide pro bono counseling.
Okay, so tell me, what are some of the misconceptions about mental health out there?
I think a lot of times when people think about mental health, they think about mental illness, and mental health is on a spectrum, and they think about, those individuals that have severe mental illness, maybe individuals that they see on the street who are talking to themselves. But mental health goes anywhere from somebody having a kind of a day that's blue to somebody who needs treatment with a hospital for their illness.
And even more moderate things like just anxiety and stuff like that.
Right. I mean, we've talked about, the storms that you guys have been talking about, the storms last night. And for some individuals, they wake up this morning, maybe have a little panic. For those who've been through some severe tornadoes in the past, they're going to have more severe symptoms. Those who had the loss of a family member are going to have some times of grief. All of that has to do with mental health.
And maybe it's not just adults, kids too, probably.
Kids too, also with storms. I hear a lot of times for some of the work that I've done and more, for kids when it starts to get cloudy, they'll start panicking, thinking, oh, a tornado's coming, because their thoughts go back to what happened in 2013.
Absolutely. And thinking as a parent, how do you spot things like that? How do you know when to take your children into a counselor?
Okay. There are several things to, consider with anything with mental health. One is, is your child having times of not wanting to go to school and the child's not sick? Is your child having nightmares? Maybe your child has regressed. Your child was potty trained and now at 6 is starting to wet the bed. There are different signs. I'd say anything that has changed and it's been at least 2 weeks, it's probably time to consider getting outside help.
Sure. And for us here at Two Works for You, how can we help? What other programs are available to get involved?
Okay. Well, of course, this is Mental Health Month this May, so I tell people, is that it might be good if you haven't been to the doctor in a while to just get a checkup. It might be good to get online and read some things about mental health. If you have a friend that you're concerned about in terms of, being depressed, not getting out of bed, it might be time to really encourage them to seek out mental health.
All right. Thank you very much, Karin, for coming by this morning.
Thank you for having me.
And of course, our focus on mental health awareness continues at midday today at 11 o'clock. We'll talk live with Mark Davis, the co-director of Housing and Recovery Services with the Mental Health Association of Oklahoma. And today at 5 and 6, our experts take calls answering your mental health questions. It's another way Two Works for You.